My name is Eoin McGrath. I'm the Executive Director of ICCBBA, and I'm just going to give you an introduction. Session today itself, we have the agenda comprising of this overview, then we'll go to that case study, and then we'll take you through the step-by-step for the platform eligibility criteria and the evaluation process, and then the subsequent awards. So you have some, there are some housekeeping aspects. So we're on what's called the live stage. There is the Q&A tab, which I think should be on the right-hand side of your screen. And as I said before, please use that to post your questions. So for some of you who aren't familiar with ICCBBA, ICCBBA is an international standards development organization, very niche, very specialized in information standard for medical products of human origin. By that we mean blood, cells, tissues, organs, human milk, ocular, etc. The term itself is a WHO term. Those who are based in Europe may be more familiar with substances of human origin, but we're talking about the same, if you like, big family of human products. The organization is global. Approximately 77 countries, or at least facilities in around 77 countries around the world, are registered with ICCBBA. We are based in the US. We're coming to you today from California, from the ICCBBA offices. And importantly, this is a non-profit organization under US regulations. Our objective, the reason for our existence, is to develop and manage a single global standard for terminology, labeling and coding of those products, those MPHOs. And in addition, to globally identify in a unique manner each of those products as well, which is a key component in robust traceability. So the Enterprise Grant itself began in 2017, and it was deliberately focused on facilities and stakeholders in low to middle income settings. I'll share with you now some of those previous grant recipients. But one important change took place last year, where the board of ICCBBA increased the allocation to the grant from approximately $30,000 to I believe last year was $80,000, and in 2025 the grant fund has been increased a little bit further to $100,000 US. So I guess the grant emerged from the observation that while facilities and professionals in every part of the world are striving and aspire to work according to the highest standards of care, there are maybe circumstances which make that more difficult, more challenging. And there is no avoiding the fact that resources, whether financial, human, technical, are critical to successful transfusion and transplantation, and particularly the management of those through IT systems, whether it's software, hardware, know-how, and professional competence and capabilities. So the grant aims to build technical capacity in those sectors in terms of safety and efficiency. We are looking to assist establishments in those sectors to achieve reliable traceability of all of those products that they are collecting, distributing, and otherwise managing. All of this supports ICCBBA in achieving our mission, which is to enhance patient safety through standardization. The support for projects may be at local level, national level, or regional level, regional being continental or subcontinental levels, and with a particular emphasis in resource-constrained settings. And the grant should facilitate the creation and advancement of a robust organizational framework, especially where those projects involve implementation and maintenance of electronic information systems and traceability functionality. So as I mentioned, we had that significant increase in funding in 2024, and we continued that in 2025. And just to show you a little bit of the history of the grant, in this slide you will see the previous recipients of the grant. This information is also on the ICCBBA website. It goes without saying that it's easy to identify that all of these projects are based in countries in low resource settings. In this case, I think it's fair to say principally in Africa. And they had a mix of objectives, whether it was implementing systems, whether it was training, whether it was supporting, in this case, if you look at 2023, the ICCBBA, the plasma project, which was inter-organizational and in the West Africa, so an international setting as well. And then last year we had 3 projects funded, all 3 related to projects based in Africa. So if I would then like to stop talking, and I'll get myself off the screen here, because I think it's very important that we actually hear from somebody who has happily benefited from the grant in the past. And I think the real life experience is something that may be more illuminating than me talking about the theory, etc. So with no further ado, I'm very, very pleased to introduce Professor Claude Tayou Tagny from Cameroon, and he will describe how they benefited from the grant and the impact it has had in their activities in Cameroon.
Okay, good afternoon, everybody. It's also my pleasure to present the outcome of the projects that have been funded by ICCBBA here in Cameroon. My name is Prof. Claude Tayou, and the projects that we have developed is the development of a reference center for quality management system at the University Teaching Hospital in Cameroon. The University Teaching Hospital in Cameroon is one of the reference hospitals in the country, with the mandate of training the medical doctors, but also training all the medical staff as far as blood transfusion is concerned. So the overview of my presentation is to give you a brief information on Cameroon, and then also what is the Safe Blood for Africa Foundation. Then I will give you an overview of the different objectives of our project, how we implemented the project, and what we found as outcomes, and then also to look what are the future actions. So Cameroon is an African country in the west coast. It's not the east coast, and it's also a low-income country. You know, we have very low resources, and we are classified by the World Bank as low-middle-income country. And in Cameroon, we have. Let me put the screen. Can I have the screen bigger, please? Excuse me. Bigger screen. Yes, Cameroon has the same medical problems as we have in other low and middle income countries. That means most of the time malaria, tuberculosis, and HIV as the key problems. And we have a high TTI risk in our blood unit, up to 15% of infected units. There is a national blood transfusion policy, like in many African countries, and there is also a national blood transfusion strategic plan, and there is now a national blood transfusion service. But unfortunately, that NBTS for now doesn't have any infrastructure for technical operation. So all the blood transfusion activities are still conducted in hospital-based blood services. The Safe Blood for Africa Foundation is based in Cameroon. It's a non-profit organization that have the objective of supporting the country in implementing good blood practices in the blood services. And for 14 years, Save Blood for Africa Foundation has worked in 20 countries already and has benefited from many support from different international organizations like USCDC, NIH, ABB, ENTS in France, and ART. And most of the activities conducted in blood services is much more training, research, development of quality management system, and also capacity building in general in blood services. So the aim of our project when we started in 2019 was to contribute to the reduction of TTI risk and other adverse reaction in Cameroon through implementation of quality management system in the blood services. So we wanted to develop quality management system in key blood services in the countries through training of the staff, reinforcement of the capacity of reference laboratory for the coordination of QMS activities in some reference blood services, and also to monitor the implementation of our action in those blood services. So these are the implementation steps that we developed at the beginning of the project. You can see on the left, these are some blood services represented there. The first project was to identify among those blood services, one blood services that will serve as a reference and train the quality management system to be prepared for the implementation of the second step. And then the second step was to reinforce the capacity of the identified blood service, like the provision of IT system and traceability system. The third project was to give a reference status to the blood service, the reference blood service, by getting an international accreditation or certification by FSBT. And the fourth step is to monitor the implementation of quality management system in the different blood services that have been selected previously. So these are the three grants that have been supported by ICCBA. The first one in September 2020, we received a grant to reinforce the capacity of the staff of 14 blood services, hospital-based blood services, with the information and skill that will enable the objective of developing quality management system. Second one, in October 2021, was improvement of QMS through installation of the data management and labeling system in the identified reference center, that is in Yaoundé University Teaching Hospital blood service. And then the third one is to obtain a FSBT certification at the Yaoundé University Teaching Hospital blood service. And then we are planning for the fourth project. That means coordination of the QMS in the other blood services. So for the first one, we conducted a training approach of the 14 blood service staff of the blood services. It was a 5 days training in an FSBT certified center here in Yaoundé. We focus on understanding the quality elements, their importance, and the overall operation of the blood service. We train the quality managers. It's mainly the quality managers just of the 14 blood services who were trained. The course used the FSBT standards and the training framework model. FSBT, African Society of Blood Transfusion, is a African Society of Blood Transfusion, for those who do not know the abbreviation. And then the training was oriented to young professionals working in the blood services. And we wanted to give them the capacity of understanding blood quality management system and how to implement it in their facility. So the training was in 3 phases. We start with a theoretical training of 3 days with introduction to quality and quality system, documentation, development, and management of the quality system, norm and standard, and also evaluation of the quality system. Then we conducted a 2-day practical session with the visit of the Yaoundé Central Hospital Blood Service that is certified already by FSBT. And we showed them how to conduct a third-party assessment and how to reinforce capacity in terms of quality management system in their own facility using the Yaoundé Blood Service as a reference. Then at the end of the training, together for each of the centers, we developed a practical quality plan. For the second project, this was the implementation of the IT system in Yaoundé University Teaching Hospital that have been identified as the reference center, as I previously said. What we did is to install a comprehensive data management and labeling system using the blood safety information system from South Africa, the FSBT stepwise accreditation, and the ESBT 128 as the framework of our implementation. Then we make sure that the hospital will also sustain the system, the IT system we are putting in place with a formal commitment to maintain the equipment and to maintain the electronic system in place. So these are the different phases for the installation of the IT system. Installation of intranet system, 7 computers and 2 servers, installation also of the software, and then development of SOPs for the data management, purchase of the donor and pack label from South Africa, and then training and mentoring of 12 staff in the use of basis, equipment, and software maintenance also, coding, labeling, traceability, and data management. So for now, in the University Teaching Hospital Blood Service, we have 15 staff trained to use the IT system. And since that time, it's only electronic system functioning in the blood service for now. The third project was now to get a certification from FSBT, but the implementation approach was first of all to develop the QMS in the reference center to align with the FSBT standard and to prepare the staff and the facility for a formal assessment. And finally, to invite the FSBT for that assessment. So at this stage, we have already started the QMS activities. We conducted a 3-day self-assessment at the beginning in order to be informed on the gap that we need to close. The work plan and quality management system was developed. And then from there, we started implementation of quality management, including quality control, maintenance of equipment, regular management meetings, everything required by the FSBT standard. At phase 2, we are now preparing the FSBT formal assessment. We have already sent an invitation to the FSBT for a formal assessment. We are still closing some few gaps. We are already at 98% of conformance with the FSBT standard, and we are expecting the formal assessment in the month of July. So for the future actions, as you can see, the 3 steps are already fulfilled. Now the last step is now to use the Yaoundé University Teaching Hospital as a reference center for quality management system and to use it to manage the implementation of quality management system in the different other 14 blood services that we identified at the beginning of the project and for which the quality managers there are already ready to receive our instruction and also to receive our training. So what we expect to do is then get certification in July for Yaoundé University Teaching Hospital, train the 14 or the 15 staff of the Yaoundé University Teaching Hospital in quality, in JMP. We also want to conduct proficiency testing for the 15 blood services across the country. We also want to conduct annual audits on those centers, harmonize our quality document across the country, and also harmonize the traceability through ESBT 128 coding system. And all these activities will be done using Yaoundé University Teaching Hospital as a reference center for the training, for the development of the document, for the coordination of all the activities in the different other hospital blood services across the country. So what are the lessons learned to end this presentation? So the implementation of quality management system and certification is at affordable resources is possible in low resources countries. We think that starting with one reference facility can be an interesting approach to expand progressively the quality management system in the country, especially in the countries where you have hospital-based blood services. We also think that tools for QMS are available. Contrary to what people are saying, we have a lot of quality management system tools like African standards, international coding, and traceability system available. We have sample documents, we have EPH schemes that we can use to implement quality management system in low resource countries. But it's very important that the staff should be committed, and also the Ministry of Health. It's very important because if there is no commitment, we will not have any effective implementation. So thank you again to ICCBA for the opportunity of supporting this project. We are now seeing the result, and we think that is something that we could continue in different other countries in Africa. Thank you.
Thank you, Professor Claude. ECPA is very excited to support your project, and we appreciate you coming on here and letting everybody know about it. Thank you. All right. Hello, everyone. My name is Christina Salinas. I'm the Global Development Manager for ICCBA, and I'm going to get to some exciting stuff here with our new platform. I'm going to cover eligibility rules and the award process. All right, great. So let's kick it off with the eligibility. When you're first thinking about applying, the first thing you want to really think about is are we eligible to apply for this application? Something to take into account is that you'll see here on these slides is whether you're a nonprofit. The application calls for MPHO transfusion transplantation services that are nonprofit organizations, public institutions.
Hi, everyone. My name is Betty Perez, and it looks like we are having a technical issue where Chris just dropped off. We will resume shortly. She is getting back on. Thank you.
I'm back.
Thank you.
Am I good? Okay, great. I'm so sorry about that. I'm not sure where I dropped off, but just quickly going over eligibility. So this slide here is going to show who is eligible. And typically, what you're going to want to look for is if you're eligible to apply for this application. So if you're a nonprofit entity, public institution, government agency, as I was saying before, you can partner with a for-profit, but the principal on the application should be a nonprofit, public institution, or government agency. So those are the things you want to think about, as well as focus area, right? If you are supporting enhanced traceability, that's particularly encouraged. If you're in a resource limited setting, that's a particular interest for us. So if this project is geared, or the objective is geared toward that focus area, you're definitely along the good lines to apply. The third thing you want to think about is project duration. Does your project go through a 12-month process or less? Those are the kind of applicants that we're looking for. The application itself is on a new platform that I'll share with you, but the information and feedback in that platform must be in English. And then the other thing you want to think about is compliance. There's a guideline on the Enterprise Grant landing page that we've created, and we'll share those resources towards the end of the presentation. They will also be on an email that will probably go out after this, thanking everybody for your time. So you'll have access to those links, but you'll want to review things like the regulation and the agreements to make sure that your project and your organization are aligned with what those criteria are to be eligible. One thing that's really exciting, and I believe Eoin, my colleague, alluded to this as well, is the fact that this year, in comparison to last year, we've increased the total fund to 100,000. That means that each applicant can now request up to a maximum of 50,000. And what that allows us to do is provide even greater support for your guys' projects. So we're really excited about that. The next thing you want to think about when you're applying for the grant or thinking about applying is the key dates, right? Are you going to be available to process the information that we're requesting? And I can see on the slide that it's not the updated one. I apologize for that. So we opened the grant February 4th of this year, 2025. We are closing the grant April 30th. 2025, and that close date is going to be due at 5 o'clock your local organization time, not where ICCBBA is located. So keep that in mind. That's key. And then the process for the review committee will be started sometime in May. And then announcements of the award for all applicants, whether you're awarded or not. Those announcements will start going out via email in June, so everyone will be informed of status. I want to hop over to evaluation because I think it's really important when you're thinking about applying. Is what is the criteria that I need to meet in that application, and how is it being scored? We have a possible of 100 points, and some of those grouped items within the application, and I might add that they are noted within the application as well as a scoring item, is the need for demonstration, right? It needs to be clearly justified, your project, your objective. The second one is the project description in itself. As I mentioned before, and I'll keep mentioning throughout this workshop, is we're looking for actions that are supporting enhanced traceability and actions within resource limited settings. So make sure you're mentioning those things in that description. The third is goals and outcomes. How's your project measurable and aligned with those objectives? The fourth is going to be a budget alignment, and there's going to be an option to upload a budget, and really isn't an option. It is mandatory. It's one of those documentations that must be included with your application. We just want to understand if there's a realistic support here for that project. The next one is team composition. Are there relevant experts that are going to be included in this project? And then the last is work sustainability. So post-grant, what does that mean? What's the impact? What's the plan for your projects moving forward? How is it really supporting enhanced traceability and those resource limited settings? So that's a total of 100 points. We want to share that with everyone so that it's very transparent in how we are reviewing that back-end application. And now for even more, the exciting part is the new platform. Last year, if some of you are new here, we had a PDF, and that kind of has been a constant in how to submit your application. And so I'm happy to report that this year we actually have a grant platform that should be helpful in supporting the efficiency and process of your application. There are approximately 7 different groups or steps that you must get through with the platform, and I've outlined them here on this slide. Register your account, read those guidelines. I've included a link here, which is on the ICCBBA Enterprise homepage. Pre-application applications have been set up, and I'll share that in a moment. And then the parts of the application itself need to be completed. We've separated them into 4 parts. The first one being your applicant organization information, the PM and staff info, project details, and the last part is your declaration. And these parts all encompass that evaluation that I just went over now, those 6 pieces that result in 100 points. So what I've done is I have some screenshots of what you'll see when you're ready to apply. you'll want to go through a series of steps. The first one obviously is the most important in getting yourself set up. So step one, you'll need to register. It's a simple email there. What will happen is that your email will be verified, because this platform will allow you to have access, and we don't want anyone else to have access to that unless they have been, verified within the email of your organization. So we're going to verify that email address, and then you're going to go ahead and add your company information or your organization in there. Step 4 is going to be to start your application. And as soon as you start your application, the next step that you'll have is read those guidelines, because that really is going to be extremely helpful in getting you set up. There's a series of pre-evaluation questions that you'll see here in step 6. And we did this because we found that in past application periods, there have been a lot of questions about, am I eligible? How do I know if I'm eligible? So we developed these pre-evaluation questions, and they're really meant to be a helpful tool. So if you go in there and you mark yes, 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 you're really doing a disservice to yourself. You really want to ask yourself if you meet this criteria, because that will set you up in such a way when you're being looked at in the review process that you actually meet that criteria, and you haven't done all this information, all the application information in vain, and then you're rejected, unfortunately. So truly take a look at that pre-evaluation setting and make sure you answer those questions. Unfortunately, if you don't answer those questions and you bypass it, the application will be rejected. It's something that is a necessary need for that application. Step 7, it consists of parts 1, 2, and 3 of the application portion, which again are some of the ones that I had mentioned a little bit earlier. It's application organization, PM and staff info, project details, and then that last bit for step 8 is going to be to submit your application. On step 3 for project details, you will have an opportunity there to upload your budget template, which you're able to download there directly. We actually have a link there that you can download and then re-upload it once it's filled out. We have another upload that's optional for your annual return, and then another area that is optional for any other documents that you see pertinent to your application. We welcome as much information as you'd like to share in regards to your project. So if you're ready to apply, this is going to be that link that you're going to want to use. It's icba.grantplatform.com. It's ready to go. So you're able, with utilizing this platform, and another reason why we thought it would be a great idea, you can come and go, you can save your work. You can, apply halfway, and if you have to get more information, save it and come back to it. Just know that the deadline is April 30th, and the platform will shut down, and we will not be accepting applications thereafter. So award information. Let's say you are awarded. You will be notified via email. The grant agreement will be sent to you, so please read that over. Grant distributions are typically sent if you're, let's say, as an example, you're awarded $50,000. You'll receive $20,000 as a single payment to start the project, and then over time, you'll see how we broken down the percentage of receipts. So 50% at agreement, 30% at satisfactory interim report. So you'll typically receive from our grant team at halfway, midline, an email saying, hey, can you send us a report and let us know? And you'll see on the right side there, we have some reporting information. Typically, we give you 30 days to get back to us and let us know how that progress is. We definitely want to continue supporting you. We want to make sure it's successful. And then that last bit is going to be the 20% at if the project is satisfactory, almost at completion, we go ahead and release the rest of the funds. So please take that into account as well when you're pulling together the information for your project, and understand how those the monies are going to be distributed. If at any time you need, extra time for any reason, an extension, all you have to do is email us, and our committee will take a look and assess and get back to you. Anytime there is a project that maybe isn't successful, or wasn't kicked off in the way that intended, those unused funds will definitely have to be returned to ICCBA. We are releasing funds with the notion that there's a start and a finish based off of your application. So if anything goes wrong within that time, please just reach back out to us, and the funds would need to be returned to ICCBA. At this time, I'm going to conclude my presentation portion, but I wish you guys all luck. And if at any time you guys have any questions, you can reach out to us anytime. Thank you.
Thank you, Chris. And we are going to go ahead and get started with the Q&A. My name is Betty Perez. I am the project coordinator here at ICCBA, and I will be moderating this event. We did receive some common questions that we'll get started with. But if you do have any questions, please go ahead and submit those to the Q&A, and we will be addressing those live. So if you're on mobile, it might be on the bottom of your screen, but if you are on a desktop application, you would see that you can submit questions in the Q&A by selecting the live stage menu option. So I'm going to go ahead and get started with the first question for Eoin. Can you please provide examples of acceptable use cases of grant funds? Are there any specific areas encouraged for the use of grant funds, and what areas are not encouraged?
Thanks, Betty. So some of them have been mentioned already, and they included training, implementing systems that support good management in a blood establishment or stem cell lab or tissue bank, etc. These can include traceability, but don't have to be exclusively about traceability. Effectively, it's anything that perhaps reduces human intervention, reduces manual entry of data and information, anything that moves on from handwritten labels, for instance. But I want to emphasize that, of course, traceability is not just about having an IT system and a scanner. The training around that, the development of good habits and good practice among the staff handling these products is equally important as well. So I think we take quite a broad view of what's needed to build capacity. I would also stress one point, and Christina also mentioned this before, but it's the sustainability of a project. So in the world of grants, not just ICCBA, but in any area, one of the observed weaknesses, of course, is that as grant funding stops, projects and initiatives may stop as well. So it's one of the sections in the application is describing how the project or the impact of the project will be sustained into the future as well. And that is something that the assessment committee will pay a lot of attention to. If I turn then to what's not encouraged, ICCBA is, we're not a science organization or a medical organization per se. So we don't encourage projects around basic science, basic research, around the medical interventions. There are numerous other entities which specialize in those areas, whether they're small associations or bigger international funding groups as well. So they aren't appropriate to our type of organization. When I was just listening to Professor Tayou, I was thinking about standardization in the broader sense as well. So returning to what is encouraged, anything around quality and standardization, I think would fit with the intention of the grant as well.
Thank you, Eoin. We're going to go ahead with the next question for Professor Tayou. What advice would you give to anyone who is considering submitting a request for grant support?
Yeah, thank you. I think Eoin started to give some of the tips that I wanted to say. But I think the first thing to recommend to the possible candidate is to submit a feasible project, because we we have some very good projects that are very difficult to implement in resource limited areas and with the limited human resources, limited um, uh, possibilities. And so it's really important to consider the feasibility of a project. The second thing is it should be interesting for the funder. I think the presentation of Chris was clear. We should align with quality. We should align also with traceability, coding system, and everything that could increase the capacity of a blood service or any other entity to make its activities traceable. That's very important. And the third thing, I think it's important for the project to be new and novel. You know, we have so many projects that has proposed, but it's always interesting to have something that is original because this will be also something that can inspire the other countries and in changing their view and in creating new solutions for limited countries. And then evidence is also important in terms of is the project able to be sustainable? The candidate should submit evidence of that, evidence of good governance also, and also evidence of commitment of the authorities in the country. Because sometimes you start the project, but there is no commitment, there is no support from your own people, and it will not work in the future. So evidence of all those commitment, good governance, and evidence also of sustainability is important. And the last, that is also for me very important, it should be relevant for the country who is applying, because everything is not relevant in Africa. You may want to implement nucleic acid testing without any resources, will not last forever. That is not relevant. So it's important to have a project that is also appropriate for the context in which you are working. So these are my small tips, and I think it's also certainly some requirement from ICCBA. And in any case, it's worked in any submission of project or research activities. Each time is feasible, each time is interesting, new, with evidence of implementation and sustainability and good governance, and also relevant for the context it works.
Thank you so much. We do have a live question. I'm going to read it for Chris or anyone who wants to answer it. For the idea that we plan to utilize, the grant from ICCBA alone will not be sufficient. We will need to supplement the grant from other organizations. If this is the case, how will the application be considered?
That's a great question, and Eoin, you can jump in as well, but I'll try to take a stab at this one. We actually have received in applications with multiple parties involved because the need is greater than, let's say, what ICCBA can supply for that particular project. And so in that sense, I think what you want to focus is that the eligibility criteria for the ICCBA portion of that grant award, that it's a nonprofit entity, a public institution or government agency that is the principal applicant for the ICCBA Enterprise Grant. The outlook of, or the overview of the project itself would need to be defined, and that's where you would pull in the supplement itself and probably identify it on your budget, I would say. But for the most part, you want to make sure that that principal applicant meets the eligibility criteria. It's okay if you're working alongside a profit organization, but and partnering with them, but the principal must be nonprofit.
Just to pick up there, Betty, I mean, we recognize that the needs often will be much greater than, as Chris said, the limits of the ICCBA grant. But that's fine. There is a section on the application which refers to possible other additional sources of income. And it also perhaps is recommended that if this is really part of a wider project, it's chopping that project into distinct sub-projects, because don't forget, one of the constraints or restrictions of the ICCBA grant is it's aimed at projects that can be completed within a 12-month period. And we all know, because anybody who's managed a project, that things don't always go as expected. want to go back to the point Chris made as well, which is that if you're making progress but are unsure if you're going to meet the end date as planned, just please let us know. We can often extend projects assuming that we know the reasons and the justification for that. But we're seeing ourselves as one of potentially several actors in achieving a goal, and I think we can provide our part. So don't be afraid to specify if there are other funders, or alternatively, if this is just one element of a wider project, that's perfectly acceptable.
Thank you, Eoin. And Chris, we have someone asking, is registration required to submit an application? And if so, if it's required or not, how do you register with ICCBA?
So I'll take that. No, there's no conditioning of being registered with ICCBA. And by that I mean of registering to be given a facility identification number and making that commitment to long-term to maintaining that registration. So that is not a condition of this grant. Clearly, we would hope that in the future that an organization, as it builds its capacity and its know-how, may get to the point where they see the value of the standards in their operations and in this safe and efficient running of their system. But by no means is it a condition.
And another question, maybe Eoin, you can answer this one, is how many grants does ICCBA give each year, and how many participants normally apply for it?
So if you recall the slide from earlier, since 2017, there have been probably between 1 to 2 awards each year. 2023, there was just one, that was the Plasma Consortium or Coalition. And then last year, because we were able to increase funding, we had 3 successful applicants. I think in Chris's presentation, she mentioned this, that if you like, there is a fund or a pot of money which is up to $100,000. From that, we will award grants and distribute that as best as we think works. The maximum single grant award is $50,000 to one organization. We may decide, for instance, to issue 4 grants of $25,000, 2 grants of $50,000, 10 grants of $10,000. It really depends on the number of applications, which then brings me to the last part of the question. I think it was to be expected that as last year we increased the amount of funding available, we did see an increase in the number of applications. I think last year was about 15 perhaps applications. This year so far, and we're still just over 30 days from the deadline, I think we have about 18 applications at the moment. We have yet to start the assessment because they're still being they're still in the process, so we don't have final applications yet. But by that I'm saying I don't know if they're all going to be eligible and valid grants, but it just gives you an idea of the volume that we will be addressing as we get to the assessment phase. And I think it's reasonable to expect that within the next 30 days we should see another 5, 10 or more applications. So it's true, we're happy to see it becoming more competitive. So there are more applicants. I think that's something that we wanted, and that hopefully will reward the better written, better prepared applicants over less prepared or less eligible applicants.
Thank you, Eoin. We do have about 5 more minutes here. I just want to remind everyone to please go ahead and submit your question. Even if we do not get to it, we will answer you after the event. After the event, should you have any questions, you can contact our help desk, support@isbt128.org, and we will answer any follow-up questions. Should you have any that you can't think of right now, but later you think of one, go ahead and send it to us. Okay, we're going to go ahead with the next question. Could you elaborate a little about the possibility to include a for-profit partner? Let's say I need someone with more IT knowledge.
I'm happy to take that one again. So this is just repeating or reiterating. A for-profit cannot be the primary grant applicant, okay? So that, according to our criteria, would rule out straight away an application. Now, it is perfectly logical that a technology-orientated project would have commercial partners supplying that technology or that know-how. So that is perfectly acceptable. All funding will go to the primary applicant. Funding will not be distributed from ICCBA directly to the commercial partner, but that you are including somebody with the know-how or with the hardware, software, etc., makes sense. So that continues to make that project eligible. But just to reiterate, the primary applicant must be a not-for-profit and/or a government agency, but under no circumstances can be a commercial entity.
Thank you, Eoin. We do have a question about the assessment committee. Who makes up the assessment committee? Many prominent people in the industry know each other. Are biases or conflicts considered, and how are those resolved?
So well, for a start, nobody on this call is on the assessment committee, so we can't be influenced because we don't actually we don't sit on that committee. The committee is made up of members of the ICCBA board. The members of the board are it's all published on our website. These are people drawn from the different areas of medical products of human origin, whether it's transfusion or transplantation. They tend to be full-time medical professionals or scientific professionals, and one of their voluntary activities is sitting on the ICCBA board. And I think one of the nicest aspects of ICCBA, this global aspect, I think is well reflected on our board, where we have a mix, yes, of some US-based members, but the majority are in fact based in other parts of the world and other regions. So that gives us a resource in terms of familiarity with context. And going back to the point that Professor Tayou said, the idea of a project being relevant to a given context. And I'm quite satisfied that we have that know-how and we can recognize context appropriate and distinguish from context inappropriate in terms of the assessment. We have rules in terms of members of that committee must recuse themselves from the assessment if they have any relationship with the applications or with the applicants. And I think in 2024 that's a 5-person committee. So again, that distributes both the expertise, but also dilutes any possible overdue influence sufficiently to make this the process transparent and free of perhaps self-interest.
Thank you, Eoin. We do have time for one last question for Professor Tayou. What challenges did you face or your team face during the grant application process, and how were they overcome, if any?
Yeah, no. For the grant application, I didn't have any problem because it was very simple. But for the implementation of the program, for the project, at the beginning, for the first project we had, it was during the COVID-19 period. So the training during that period was a little bit difficult. Then we used that different measure that everybody knows, distancing, using of mask, hydroalcoholic solution, and that works without any problem. But for the two next projects, implementation of IT system and quality management system, we had some staff a little bit reluctant in the benefit of having quality system, But yes, we convinced them on how the quality management system would ease their work and improve the quality of the system and also the results and the quality of the product. And now they're happy. Even the hospital is also happy because IT system is easing the task and the work is very correct now, and we are even recognized now in the country like the reference center. So we still have to work for, but yes, it's now a good thing. So yes, reluctance could be the challenge that I had, but convincing people and explaining them why is it so important to use quality system and traceability finally is they are all up.
Great. Thank you so much. I'm going to go ahead and bring up the resource slide for everyone.
Hey, Betty, before you do that, I just wanted to reiterate some important dates for everyone before we log off here. So we're just maybe over a little month that the grant will close. So April 30th is a date you guys all want to keep in mind. Set it on your calendars. 5 p.m. Local time for your organization is going to be when that platform is going to completely close. May we'll have the selection committee review, and in June we'll be in touch with all applicants. Thank you.
Okay, so we're just coming up to the 60 minutes. So first of all, thank you very much to my colleagues, but also particularly to Professor Tayou for the that real life experience, which I think is invaluable. And I hope it's helped the listeners and the viewers to understand better what they need to do. And just in terms of the dates, yes, there is over a month to go to the deadline, but please don't underestimate the amount of information that you will be asked to submit in terms of the budgets and the expertise descriptions and the etc. So it takes a little bit of work, and so don't underestimate that. So start sooner, go into the application, check the questions, and you should fully expect to do this in several sittings, not just in one quick form filling. So it's one important lesson. We are very happy to take questions by email afterwards, and so that's support@ISPT128, and you're also welcome to reach out to us individually if you prefer. And with that, I'm going to close today. Thank you for all of our attendees, and I hope this has been useful to you. We will be, Chris, are we going to survey people afterwards to get feedback?
We will not be surveying. We will survey those who apply.
Okay. So is there anything that we haven't said here? Just the link there is to the newsletter, which will also contain important information on the grant. And then keep in touch on new things with ICCBA through LinkedIn, Twitter, and YouTube as well. And best of luck to all our applicants. Thank you very much.
Thank you, everyone. Thank you, Professor Claude.
Thank you.